thank you very much for staying with us on Focus on Health. So before the break, we were talking about kidney transplants, and we are now joined by Dr. Brenda, a specialist, and also somebody who's been in this field for a very long time, to just shed more light on what kidney transplant is and what it really means, and of course, if there is any danger on doing kidney transplant. So thank you very much, Doc, for joining us for this interview. So basically, we all know what kidneys are, but if you break that down for us, what is the importance of a kidney that when it fails, it causes such an alarm to the body?
All right. Thank you so much for having me on the show. And so I'll just start by defining, we all know what the kidney is. The kidneys are just basically two bean-shaped organs that are found on either side of our spines. They're small organs, but they do have a lot of function and a lot of importance in the body. One of the main reasons why the kidneys are important is because they actually are filters. Okay, so they usually filter a lot of waste products from our blood, and this helps in maintaining normal bodily function. The kidneys also produce very important hormones that help us in our day-to-day activities, taking care of our blood pressure, and they also produce some enzymes that help in regulating our blood pressure and also in the production of blood, and that is why, basically, why they are very, very important.
So, and at what point do we know that we have a problem in our kidneys? What is some of the signs that one should look out for?
Okay, so when you start developing signs and symptoms, or rather when you start having kidney failure, it doesn't just happen at once. It's a slow process that is step by step. The very early stages are actually asymptomatic, meaning that they do not have symptoms unless perhaps blood tests are done, and then they are incidentally found to have problems. But as the disease progresses, then you might start experiencing symptoms, and some of the main symptoms, very common symptoms, are, for example, swelling of the legs, that's the limbs, puffiness of the face. You notice that you become easily fatigued with the normal exercises or normal activities, day-to-day activities. You might also experience shortness of breath, dizziness. These are some of the main things. And the other thing is a problem with urine. So either you notice that you're producing a very small amount of urine, or you start going to the loo much more frequently than usual. So this is some of the signs that you need to watch out for during the early stages.
And are these signs particular, or are they kind of to a certain age group, or it can happen to any age group, these signs you're talking about?
All right. So kidney failure is something that cuts across. All right. And there are risk factors that will usually determine perhaps what age, and there are causative agents again that need to be figured out to determine when the disease can strike, or when the failure rather will start. It pretty much depends. Obviously, the risk of kidney failure increases as we age because of, obviously, you're aging up. But then we can have other pre-existing conditions. For example, diabetes, that's high blood sugar and high blood pressure, put you to be more prone getting the kidney disease. You can have infections as well, which can cause direct kidney injuries. You can also have cardiovascular diseases, problems with the heart, that can lead to kidney problems. Okay.
But just cutting you, just for a short while, we before the break we were talking to somebody who was having kidney failure, and he was relatively young. What really makes you, or why such a young person? Because the risk factors, it is as you age, then it is more common. But this was a relatively young guy, around 20 or early 20s. Tell us about that. Talk to us about that.
All right. So like I said, fine, age usually does put you more at risk because of other comorbidities that you can get at that year. But that is not just the thing that can cause kidney failure. There could be other conditions like autoimmune diseases, all right? So autoimmune diseases are basically when your own body forms antibodies against your healthy kidney. So it's nothing that is limited to a certain age or anything. Can happen at any time. Even in children can have autoimmune diseases. You can also have infections in a young person, all right? Urinary tract infections, it does not discriminate. It can happen at any time. You can also have acute kidney injuries. You can have direct injury to your kidney, which does not discriminate. Like, it can happen to anyone at any particular age.
But just before you continue, we realize that most as Kenyans, we really get to know about kidney failure when we are going for dialysis. What is just the importance of somebody who is not really gone to that the end stage? What is the importance of them to do follow-up each and every then, so that they can at least have all these options to before they can have dialysis and of course transplants? What is the importance?
It is very paramount. As Kenyans, it's true that most people will only go to a hospital when they feel like they cannot handle it anymore. All right. So what we're trying to do basically, it's to make people aware, first of all, that this kidney failure it's rampant, it's on the rise, and it can get really fast to that point. But the other thing is to also let them know that it's very treatable if caught early. Like, it's very easy to reduce or slow down the progression of the disease if caught early and interventions are made prior to it getting to that end stage.
Okay.
So I feel like sensitization is the main thing here, that people need to go for routine checkups at least annually to just have tests done to check on their kidneys. People need to watch their diet. People need to watch the weight. People need to watch their pressure and their sugars if they are diagnosed as diabetic or hypertensive.
So tell us about the available options that you'd mentioned earlier, that is transplant and of course dialysis. Yeah.
So yeah, both options are there for us, available in Kenya, and they are in most hospitals. Dialysis, especially, is now the coverage is quite good right now. Transplant, it's there, yeah. It's still catching up. It's not as available as the way dialysis is, but both are available in the country. So you obviously for dialysis you go for sessions between 2 to 3 sessions a week. Ideally, should be 3 sessions a week. It'll help. The thing about dialysis is that it basically does what the kidney would have done. So you're connected to a machine, then there's like a catheter or your vessels are like a tube placed, and then it goes all the way to the machine, and your blood will travel all the way there, and then basically the dialyzer will filter. So that helps to continue, but you have to do it for life. The only other option now after dialysis is going to be doing a transplant. Yeah.
And now when we're talking about transplants, how dangerous or how safe are transplants?
All right. So transplants are obviously surgical procedures, and just like every other surgery, whether major or minor, they do carry their risks, they do carry their benefits. In the case of like renal failure, obviously when it's end stage, having a transplant would be more beneficial than not having a transplant. So you do have options. Obviously, you have to go for some sessions, some pre-tests that need to be done before the transplant is done to make sure that both the donor and the recipient are in good shape to be able to go for their transplant. And there are tests that are done, like I've said. But once the transplant starts, like it's a surgical procedure. So just like any other surgery, there's risk of bleeding, the pain is there. Obviously, there's risk of infection, and afterwards, there's even the risk of rejection, whereby your body rejects the donor kidney. So these are just some of the nitty-gritties about the transplant. And
when we talk moving from that, of course, how costly, how cost effective when you weigh both these, when you weigh having a transplant and of course having dialysis, how cost effective are either of them, and then also vis-a-vis the long-termness of it?
All right. So like I said, dialysis is for life. All right. And dialysis, usually a session would cost anywhere between 5 to 10,000 in our facilities here in Kenya. All right. We do have the NHIF, which is the national insurer. I believe it covers for 2 sessions a week.
Yeah, 2 sessions.
Yes. But remember that you'll still have to pay for the 3rd session on your own, and that would go, it's every week. So if you do the math, I mean, for 52 weeks in a year, obviously that would have covered for a renal transplant in the country, and also the national insurer would also pay for that cost of that, yeah. But the thing about when you go for the transplant, obviously there's the medication that you need to take after. You need to take some immunosuppressants, and you might also need to take some medication if you get infections afterwards. So this will be dependent on the also medication burden. So you still have to factor in the cost of the medication that you need to take monthly, which might be, I believe it could even reach about 35,000 in a month anyway. So at the end of the day, you need to weigh benefits, and you also look at the patient. So you need to look at the age of this patient. Do we think that this patient is going to benefit more from surgery, or do we have other comorbidities? Because it will not make sense when the patient is very elderly, like in their 80s and 90s. They have other comorbidities like diabetes and high blood pressure, and you want to take them again to theater.
Thank you very much. In 30 seconds, immunosuppressants, are these used for life?
Now, immunosuppressants ideally will be used usually for, they're usually, how do I put, tapered down, yeah? It depends on but usually after the surgery, the patient has to be put on immunosuppressants, for sure. They will use it for a very long period of time. And remember that immunosuppressants also carry side effects with them, right? They don't just work. The main purpose of immunosuppressants is to prevent your kidney from forming antibodies against this new kidney, all right? So obviously you will need to take them for a long time, but remember, they don't just target these antibodies that go to the kidney. They also suppress basically the entire immune system. So they will put you at risk of getting other infections that could also affect your kidney. So it's usually you need to balance, but they will be taken for a long period of time after the surgery.
Thank you very much, Doc, for your time. That's all we had, and I think we'll be discussing more in our subsequent episodes. So back at home, that is all we had for you on Focus on Health, and I'll be leaving you with the Did You Know segment. See you next time. Bye-bye.